Today's topic name is Glossopharyngeal breathing, GBP. What is a GPP? Is a technique useful in a patient with a reduced vital capacity and owing to respiratory muscle paralysis, for example, poliomyelitis or tetraplegia. Poliomyelitis were observed to be gulping air into their lungs. It was this gulping action that gave technique name is frog breathing, also called as a frog breathing. GBP, glossopharyngeal breathing, is a form of positive pressure ventilation produced by the patient. Voluntary muscles where blows of air force into the lungs. Paralyzed patient depend on the mechanical ventilation may be able to use GBP, glossopharyngeal breathing, to continuously other than during the sleep to substitute the mechanical ventilation. The most common use of glossopharyngeal breathing is in the patient who are able to breathe spontaneously but who was power to cough and clear the secretion is inadequate. The technique may enable this patient to attract attention, and it may be help to maintain the improve the lung and chest wall complication. To breathe in a series of pumping stroke in produced by action of lips, tongue, soft palate, pharynx and larynx. Air is held in the chest by the larynx, which is act as a alveol or as a mouth and open for the next gulp. Before starting to technique a patient glossopharyngeal breathing, it is helpful for him to inflate his chest during the intermediate positive pressure ventilation with a mouthpiece. He can practice holding in breath while removing the mouthpiece and avoiding the access to air throughout the larynx or nose. The most important step in learning GBP is the up and down movement of the cricoid cartilage while keeping the jaw still. The patient can practice by watching the movement in the mirror and feeling the cartilage with his finger. ये उसके स्टेप है. फर्स्ट, द माउथ एंड pharynx are filled with air by depressing the cricoid cartilage and tongue. You can see here in this diagram. Second step, while maintaining this position, the lips are closed and trapping the air. You can see here in this diagram. The floor of the mouth and cricoid cartilage are allowed to rise their normal position, while air is pumped throughout the larynx into the trachea. This sequence should be practiced slowly at one and then gradually speed up until the movement follow. A leak of air may occur throughout the nose, and until it is prevented by the soft palate, a nose lip may require.